everyone. Believe it or not, we are full already. It is being live streamed, so if there are people who cannot get in and they may be SMSing you, please can you just tell them that it is being live streamed on the Northern Conference Facebook page. And we are now going to hand over to Dr. Laguno, because there's a lot of misunderstanding on the whole vaccine issue and the church. So Dr. Laguno, thank you very much for being here this evening. And I'm going to hand over to you now.
Good evening, everybody. And thank you so much, Connie, for having this opportunity. And thank you also for our participants and including also our audience who have come to listen to this very vital topic, which will really determine the outcome or even our destiny. I would like first to share my screen. Okay, thank you. Okay, there it goes. Okay. Thank you so much for the organizers for inviting me. And I pray that what you are going to hear today is going to help you in the decisions that you are going to make. You know, the church is also concerned for each of its members. And as a result, it comes up with certain guidelines, and especially these days wherein we have this very devastating pandemic of COVID. And I'm sure all of us are affected, and all of us have either a friend or maybe even ourselves that have been affected, but not only that, but some have in fact prematurely gone to the grave. And this is also a big concern for the church. Now, when it comes to COVID, what we really want to have, first of all, is prevention. There is no better cure than prevention. But of course, we know that sometimes prevention is not going to work. There are certain factors that prevent this from coming into fruition. And as a result, we have to come up with certain what we call strategies, especially for this COVID. A church concern now, when it comes to COVID, just like any of the diseases that we have, the church is really promoting what we call lifestyle strategies, okay? And maybe you have actually heard of so many of these, but I think the most familiar to all of us is what we call New Start. The 8 natural remedies, which Mrs. White had mentioned. And well, the General Conference came up with what we call an expanded form called celebrations. Basically, they are just the same, except for the celebrations. You have actually choice, and you have what we call integrity as in I. And this is very important, especially with COVID. As you know, so many people are also utilizing this pandemic to be able to make money. Not only that, but this integrity is also going to determine so many of the outcome. A very good example, for instance, is in Mauritius, wherein a doctor saw a patient. The patient had fever, and so he asked this patient if he had been out of Mauritius. And the man, afraid to divulge his true condition and afraid that the doctor might not see him, said, "No, I have not been out of the country." And the doctor started to give him treatment, but unfortunately he had COVID. Now, the patient survived, but unfortunately the doctor died. It's because of geographical integrity. So that's part of celebration. And of course, the last one there is S, which is social networking, which is very vital as human beings, for God has actually made us social beings. Similarly with creation, creation too is also just another adaptation of the New Start. So please remember that these are very vital, the 8 natural remedies and its expanded form. This is what the church is really promoting. But also this COVID has really emphasized that, you know, we need to be very careful of what we call NCDs, or non-communicable diseases or lifestyle diseases. And we know that COVID-19 is more dangerous to people having comorbidities. This is from New York, of course. This is in America, but it is also applicable here in Africa, wherein 96.2 of all the patients, especially the COVID deaths, involve at least one comorbidity. And you would see that hypertension, diabetes, hyperlipidemia, down the line, are actually what we call lifestyle diseases. So now you can see that the new start or whatever celebrations, we have always been trying to emphasize that we can actually prevent, if not delay, the onset of these what we call NCDs by following these 8 natural remedies. And of course, here in Africa, okay, patients suffering from hypertension, diabetes, HIV/AIDS, or obesity are at higher risk of COVID, and not only that, but also COVID deaths. Now, the reason why I emphasize here this from Africa is because you can see it also emphasizes hypertension and diabetes plus HIV/AIDS. And we should realize, you see, that here in South Africa, we have the highest number of cases in the world. And we know that HIV/AIDS is really a lifestyle disease. Now here, for instance, in Western Province in South Africa, 8% of all the deaths from COVID were related to HIV/AIDS. And people who have HIV are 2.3 times the risk of death. But as I had mentioned earlier, it's very possible we are following all the guidelines when it comes to New Start and celebration, and yet some people are going to end up getting sick. Okay, so it is very important that we are going to have what we call additional armamentum, okay? Because vaccination, immunization is part of the program which the church is encouraging for good health, okay? Now, unfortunately, some people are actually looking at this as either or. That means you have to follow vaccination only. If not, you have the lifestyle only. But no, we have to realize that these are what we call combined armaments, which the church is encouraging people to partake in order for its members to have good health. They have found out that longevity or the increase in the length of years in many countries have been attributed to 3 very important aspects. Number 1, clean water. Number 2, sanitation. And number 3, vaccination. It is not those transplants or what we call open heart surgeries or coronary bypass or cancer treatment that has really what we call extended the length of the years of people, but rather these 3 very important parts: immunization, clean water, and sanitation. And as a result, the church actually came up with this statement, you see, statement from 2004. This statement, in fact, came long before the COVID pandemic came into effect. It was in 2004 that the church came up with this. It encourages responsible immunization. It is not based on any religious or any faith-based reason, but really it is protective. It's responsibility to participate and protect, including protecting also others. And this is the position which the church is encouraging, okay? We are not mandating, but we are encouraging. And so some people are actually saying, why is the church coming up with this position instead of just being neutral? The point that we are actually encouraging is because the church realizes this importance, especially we as stewards of our own bodies. And also our bodies are the temple of the living God. And what is important is now, how can we extend life, or how can we maintain good health so that we can be a medium by which God can use us, you see? What's the point if you are going to die at 20 years old when God can actually use you up to 60 or 70 years old? And sometimes that actually requires the use of the vaccine. So now let us look into the position why the church is encouraging and coming up with that position and not just being neutral, okay? Now, vaccination actually prepares the body for a possible invasion, whether it's going to be a virus or whether it's going to be a bacteria, any foreign invader. When you are going to have what we call vaccination, you are actually preparing, okay? Now, this actually is happening here in South Africa. You already have soldiers who are there who are ready for an attack. whereas the natural immunity actually waits first before an invader comes in, whether it's going to be a virus or a bacteria. And once it is going to enter, then that's the time that the body is going to make its soldier cells or antibodies to fight against the invader. Now tell me, logically speaking, which would you prefer? You are going to be ready, just like you have actually an army going on in case there's going to be an invasion, or you are going to wait and say, oh, anyway, I'm just going to wait, and then when the invader comes, that is the time that I am going to prepare. Okay, so that's it, natural immunization. Okay, it is, the body is not ready, it has to prepare, and as a result, we actually have found out that many of the COVID cases, okay, they have been admitted, and then later on they become negative, but then when they become negative, they die because of the complications. So you see, it's true, they were able to form antibodies, but then it was too late. Okay, now vaccination makes ready the body for a specific attack, and that's actually the difference there, is because it is directed specifically to an offending organism. And then once the offending organism is coming in, immediately the attack takes place. These antibodies, which has been pre-formed, are going to attack this invader. Whereas the natural immunity, which we're talking about, well, it takes time, and then the invader is going to already enter. And this is it. That's the reason why we're also encouraging people to wear masks, is because you see the severity of the disease. One of the reasons for the severity of the disease is what we call the inoculum. Inoculum is the initial exposure to the virus or to the bacteria. Now, if you are going to wear a mask, what happens is that even if you are going to be infected, but maybe only about 100 viruses or viri, as that is really the plural for virus, okay? At 100, then it's very easy for the body now to be able to prepare and to launch a counterattack. But for instance, if you are going to be immediately inundated with 1 million viral particles when you are going to have the infection, can you just imagine? Okay, so that's the reason why also mask is very important. Although sometimes people still, I mean, many times even though you wear a mask, but yet you get sick, but then it is not so serious. Okay. And vaccination operates with a natural immunity by an antecedent and a specific stimulus. See, the vaccine actually is going to create a stimulus by which the body, okay, the natural defense of the body is going to be stimulated to produce what we call antibodies. And that is what is very important when it comes to immunization. Now, let me just give you a brief. I know that Dr. Mbilengi is going to mention about the vaccine, but let me just tell you that generally the vaccines are actually what we call divided into two categories. Number one, it's going to be what we call a dead virus, which is presented to the body. The other one is exposure to a part of the virus or the spike protein. These are actually the three different types of vaccines that are there. And I'm sure Dr. Mbilengi is going to mention that. But what I would like to mention here is, how come it is going to be the spike protein? Okay, well, that is how the virus looks. You can actually, that's the reason why it is even called corona, is because of the spike proteins that are there. And remember, it is the spike protein that actually enables the virus to enter into the cell to reproduce itself. Okay, in other words, the spike protein is the starter. Okay, a very important starter. Without the spike protein, the virus is not able to enter into the body. So now that's the reason why these vaccines are really targeting or zeroing in into that spike protein, because that is the one that causes the virus to enter into the cells and then reproduce. So just to give an example, now you have such a very beautiful car. I wish I had a car like this. Now, even though you have such a high-powered, beautiful, luxurious car, if it actually does not have a good starter, And I'm sure many of us have experienced that when we go into our car and then we start the ignition and then the car does not start. Why? The ignition is wrong or is not functioning. And similarly, the spike protein in a way is a starter or the ignition of the virus that is able to make the virus move and replicate. And by destroying the spike protein, then the virus cannot enter. Not only that, but it is going to be destroyed. Okay. Now, one of the concerns that people have is actually the DNA alteration. Now, as I said, there are 4 different types, and Dr. Bilengi is going to mention that. But then there, what we call assertion is that these mRNA vaccines are going to do DNA alterations. Now, there has been no proof, and I'm sure Dr. Bilengi is going to mention more of this, but let me just mention to you some of these DNA alterations. Now, there are many in the environment that actually causes what we call DNA alterations, okay? But what is important is that if there is going to be any DNA alterations, hopefully it is going to become actually for the better. To actually, and this is what our scientists are trying to do. They're going to try to extend life by trying to tweak the what we call telomeres of the DNA. But here are just some of the examples. Tobacco chemicals are known to alter DNA. Now, benzopyrene. Now, benzopyrene is really what we get from tobacco, but you have to remember that even benzopyrene can be produced when we are doing what we call steaks, when we are doing barbecue or braai. If we are going to braai a 50 or 500-gram steak and you have the fats and the fats are going to burn, they actually become benzopyrene and they can do what we call DNA alterations, okay? Alcoholic drinks, sunlight or ultraviolet rays, radiation like X-rays, viruses, hepatitis and cervical cancer, nitrosamine, and about 3 years ago, the WHO came up with the guidelines and say, you know, these ones are actually carcinogenic because they alter also the DNA and cause mutation. So this is the pinkish material or orange materials that you find in sausages and corned beef. So my friends, if we are concerned with DNA alterations, we should also be very careful with the other things that are here. But when it comes to the vaccine, it has not been proven that it can actually cause DNA alterations, okay? Now, there is actually the new science called epigenetics. And epigenetics is a new field in science that says that they have found out that many environmental factors are actually causing what we call influencing the genes, whether it's good or for bad, okay? Now, they also say, okay, vaccine. There are actually some of the things that they say, okay, the vaccine has fetal tissue. It has actually, vaccine cannot cause COVID disease. It does not have any fetal tissue. It does not have any microchip, no egg protein, no pork products, no blood products, no material to cause sterilization. Let us go one by one, okay? Okay, it is true that in the development of the mRNA vaccine and also in JJ vaccine, okay, mRNA vaccine, they use what we call aborted fetal cells. It is true, okay, for the development. It is not in the manufacturing, it is in the development. Why? Because they have to test, okay, they came up with a vaccine and they when this vaccine or these particles are going to be introduced, whether they are going to be able to produce what we call antibodies. And that is the reason why they were using what we call fetal cells, okay? It was only in the development, but not really in the manufacture. So the actual vaccine does not have any fetal particles, okay? But the original fetal cells are not the original which were aborted, okay? But they are now cloned tissues because now they say, oh, why should we use a vaccine where they have been using aborted fetal tissues in its development? Well, let us look at it. As I said, they are no longer the initial aborted cells, but they have not. But let us go into the justification of its use. Now, like for instance, in the case of Joseph, who was sold to slavery, Joseph actually said, you know what, guys, you intended evil, but God had turned evil to good. And this we can apply to this situation, the development of the virus using fetal tissues, wherein, well, it was bad, but then it can later on turn out for good. Now, very good example, for instance. We have, for instance, you have a nominal father, okay, a nominal father who is maybe a Seventh-day Adventist only name, but does not really follow the precepts, does business on Sabbath, even has 3 wives and 1 girlfriend. But then out of this nominal father, a preacher son is born. Now, are you going to say, you know what? This preacher son, his father is actually not a good Seventh-day Adventist. Let us not listen to his message. See, it might have started bad, but then a good came out of it. And this is what we're trying to drive at on this mRNA, which use fetal tissues. Number 2, for instance, you may have a nominal son, okay? And the father is a good preacher in the church, okay? And then the son is going to say, Dad, you know what? I really sympathize with you. Your salary is not so good. Let me buy you a very good car that is going to help you in your ministry. Now tell me, as you as a father, you're going to say, no, I'm not going to accept that, son, because you know you are actually not following the precept of the Seventh-day Adventist Church. Okay. Well, these are just some of this application of these what we call fetal cells. Okay. And I hope that you can think clearly on this matter. Okay. Now contains RF chip. You know, they say that this vaccine has what we call nanoparticles, and these nanoparticles can transmit what we call messages or what we call electronic, whatever there is going to be. And so they said, if you are going to be vaccinated, then people can actually just trace you. Of course, we know that in the end it's going to happen, but let us not try to mix it together with the vaccination, because you see the actual what we call size of an RF to be able to transmit what we call the signals is the size of a grain of rice. Now you can actually see in the picture here, that's how the size is. And the vaccine does not have this big size in its particles, nothing of the sort, okay? But let me just look at it, okay? As I said, the smallest size of this, what we call RF, is the size of a grain of rice to be able to be effective to transmit signals. Now, but if you are really concerned of these signals being transmitted, that means that we should actually discard our cell phones, our smartwatches, our tablets, our laptops. Why? Is because all the time they are what we call sending signals. A very good example of this is Jonas Savimbi in Angola. He was fighting the war there. And Jonas Savimbi made a what we call call, a satellite call to his buyers of diamonds in Europe. When that happened, the Americans picked up the signal and they told Dos Santos, Savimbi is there. Yeah, you go there and you'll be able to catch him. And of course, we know that that's what they did. They caught Savimbi because he made a call to a cell phone. And these days, as I said, even smartwatches, even if we turn off our cell phones, I heard that they can still transmit. Whereas Osama bin Laden was so smart, he learned the lesson of Jonas Savimbi, and so he said, no, I'm not going to use any cell phones. He doesn't use any laptops. He was using a courier. But you see, the Americans were able to identify the courier, and that's the reason why he was caught, okay? Now, but the problem is that what is really our intention if we are going to be able to be traced? Is it that we want to escape? Is it for self-preservation? Or is it because we want to follow God's ways? Okay. Now, according to Ronald Reagan, you can run, but you cannot hide. And that is actually true these days. Okay. With all the gadgets going on, with all the surveillance. Okay. Now, how can we actually fulfill God's divine commission mandate if our intention is self-preservation? Okay. A very good example of this is the Apostle Paul. Apostle Paul, when he was in Ephesus, he was met by the prophet Agabus, and Agabus actually told him, do not, the person whom I'm going to bound with this cloth is going to be caught by the Jews and going to be brought to the whatever trial. And the friends of Paul said, Paul, please do not go to Jerusalem because you are going to be caught. And what did Paul say? No, if that is really what God wants me to be so that I can preach the gospel, then I am going nonetheless. So Paul was not afraid to really go where the action is, even if he knew that he was going to die. Similarly, Jesus going to Jerusalem. When Jesus told Peter, Peter, told his disciples that he is going to go to Jerusalem and going to be handed over to the Romans. And Peter said, no, please do not go. And Christ said, Peter, you do not actually favor the will of heaven. Okay? And this is it, my friends. Whether it's going to be RF or not, but what is important is our intention, whether we want to follow God's will. We want the divine commission to be finished in this world. Okay? Another objection that people are using pork or blood parts. Okay? So, those vaccines maybe have pork or blood parts, or maybe they have used some of these materials that are not kosher. Okay? Well, when it comes to pork or blood products that are part of the manufacture of the vaccine or any medications, let us look at some of the medications that are there. For instance, Oscal, which is really calcium. Taking calcium supplements that they get this calcium out of the bones of any animal, whether it's going to be a cow, a mule, a donkey, a horse, or whatever, and they pound them together and they make it into a tablet. Okay. Similarly, for heart surgeries, we use porcine heart valves for those valves that are not anymore sufficient. We do replacement, and some of these valves really come from the pig, porcine valves. Now, if you are taking medications and these medications are made out of gelatin, the capsule, the gelatin too comes from animal fat. Okay, what they do, they get all of these, what we call cartilages from dogs. I don't know what dogs, but you can be sure that they come from pork, they come from horses, and they get this and they make gelatin out of that. Of course, these days they can already make gelatin not only from what we call animal fat, but I tell you, it is also part of it. So what are you going to say? I'm not going to take that Oscal. I'm not going to take that gelatin because it really comes from pork, okay? Hormonal replacement therapy, similarly with that, which women are using. They also harvest the ovaries of rabbits or maybe horses, okay? So according to the GC vaccine statement, vaccines are medication to save lives and they do not serve as food, okay? It is actually clear here, you see, that let us not consider it as food, okay? Because you see, these are not food, but really involved in the manufacture. Let me just, okay? You know, I hope that I would be able to send this later on so that you can really have a look, because we are running out of time. But according to the statement of the GC, really, this is not food. It is different, you see. These do not apply for vaccines for obvious reasons, that vaccines are not produced, okay, as medications to save lives, not to serve as food, okay? Let me just read again. This does not apply to vaccines for the obvious reasons that vaccines are produced as medications to save lives, not to serve as food, okay? Okay, 666, mark of the beast, okay? Now, we have to realize that the mark of the beast is really about worship. It is not what we call about vaccination, or else it is now clear that we say, well, you know, vaccine is really 666, and nowhere do we see that in the Bible. What is really important is that we have to realize that the 666 that is mentioned is really, it's about worship, whom we give our allegiance to. Now, so many of us have to realize, and all of us have to realize, that the highest form of worship is really total obedience. That is found in 1 Samuel 15, verse 22. Okay. It's good to have what we call services of singing, of reading God's word, of singing praises, or giving our tithes and offerings. That's really good, you see? But really, in the end, what is of utmost importance is whether we obey God. And in the end, this is what is going to distinguish between the mark of the beast and the mark of God. Why? The mark of the beast means you are obeying, you're giving your allegiance, you're going to give your worship to the beast rather than to give it and follow the commands of God. Okay? Now, SDA understands the mark of the beast to be not a literal mark, but a sign of allegiance, and identifies the bearer as loyal to the power represented by the beast. Just to give you the full view, this is the full view of what we call the statement on whether the vaccine is 666 or not, okay? For this reason, it should be made clear that Seventh-day Adventists understand the mark of the beast to be not a literal mark, but a sign of allegiance to identifies the bearer as loyal to the power represented by the beast. So friends, if you really want to have the mark of God, it is really total obedience to the commands and to the law of God. Now, there are also many people who say, you know, you can actually die and when you are going to get the vaccine. Of course, that is what we call a remote possibility, because the thing is that there are certain what we call allergies that may develop, but not only that, but also what we call complications, but very, very rare. But unfortunately, so many people associate the vaccine with death, a lot of deaths. Okay, let me just give you an example. For instance, you are a missionary, you are serving into a what we call a foreign country that does not know anything about soya milk or good food. And what you do is that you believe that the soya milk is good for the health of people. And what you do is that you tell people, okay, it's very good that you should be drinking soya milk, if not milk. And you give an old person soya milk, and all of a sudden, the person dies. Now, what actually people immediately will think, can you see now that soya milk is the one that has caused the death? Well, in fact, it is not. It is very possible that that person really died of a heart attack. And this is it. When there are actually deaths that are associated with the vaccine, it is very important to distinguish whether it is what we call associated and not really the cause. It is just because of the incident that has actually happened. It is not really a direct cause. And this is what is happening. When there are going to be deaths associated with the virus, it is very important that we are going to investigate, and scientists are there. There are actually sites that you can visit, and they are going to verify whether that death is really by the vaccine or something else. There is also what we call risk benefits. In life, that is really what is happening. There are benefits and there are also bad points. And this is what we call risk versus benefits. For instance, we all know that not all airplanes, if you ride an airplane, that there is always a possibility of a crash, okay? But why is it that people continue to fly with an airplane? Why? Is because they realize that the possibility of a crash is very, very, very minimal compared to the benefits that you can get, and that is accepted. And similarly with the vaccine, it is just like that. It has a great benefit, but very, very low risk, you see? But we have to take that risk. But it is a calculated risk because the benefits are much, much more bigger compared to the risk, okay? Now, for instance, we have what we call risk benefits of COVID vaccination. It actually protects about 95%, especially the ones that are for severe COVID, because really the intention is maybe you're able to get the COVID, but then you, as long as you don't get so serious or complications, that you can survive, okay? And this is it. They have found out that the vaccine is able to cover severe COVID and death, okay? It is going to protect 50 to 60% against mild to moderate COVID. That means maybe you get a little headache or getting fever, but then in the end, you're going to recover. Decrease in sick time, decrease in transmission, and also cheap versus hospitalization, okay? Now, these are just examples that I know personally, you see? There was this one man, he was in the ICU for 4 weeks because of COVID and he died, okay? Another one, 6 weeks in the ICU and then died. Another one in the ICU spent $100,000 and yet died. Another one, 120,000 US dollars and again died. So now, which would you prefer? Okay. We as doctors have what we call Hippocratic oath. Okay. It says first, do no harm. And that is it. As doctors, we practice that. But how we wish that the alternatives are actually clearly 100% good and 100% bad. Unfortunately, that is very difficult. There are always risk. There are always what we call side effects and in anything that is good. For instance, in the case of quinine for malaria, I don't know whether you have tried quinine, but in my own experience, because I was serving in various mission hospitals where malaria was rampant, and there was one time that my malaria was so serious that I was afraid it was now going into my head, and I had also what we call resistant malaria. When I first started, it was only +1. After 3 or 4 days of taking the conventional medication, it went to +2. And now I said, wow, if I'm not going to take these serious medications, it might go into my head and I'm going to die. And so I decided to have what we call injectable quinine. I tell you, it was so serious. And I know that by taking that quinine, my heart can stop because it can cause arrhythmia. But I knew that my chances for survival was much better if I don't take quinine. And similarly with the vaccine, it might have risk, but your chances of survival is much, much better compared to if you do not. And that's the reason why I'm here right now, is because I actually decided to take quinine. I had serious side effects. I could not hear people speaking. My taste buds were all numb. I had to fast because I couldn't eat for about 5 to 7 days. Every time I stood up, I was dizzy, but I said, I have to take this medicine because this medicine is going to make me survive. My chances are much better than if I don't take the medication. Similarly with Septrina, Fansidar, okay? Fansidar used to be a very good medication for malaria. Now, unfortunately, it also had a side effect of what we call blisters. They call Stevens-Johnson. But then I had to take it, or else when I had malaria, I was afraid that it would go into my brain. So can you see? Now, similarly with hormone replacement therapy, which some of the women are using, and contraceptives, okay? They can produce clots, and people have been known to die because of these clots. But yet we continue because we know that it has what we call benefits, and the side effects or deaths are very few compared to the benefits that it is going to give. Similarly, in the case of COVID vaccine, there is really also a possibility that some people, very, very rare, can die, but yet overall, it is going to be of great benefit, okay? Anyway, like for instance, in the Philippines, they had something like 300 cases only with the first dose, okay? And they were only using Sinovac. 173 got COVID, which is about 0.046% with only 11 deaths, okay? Out of 3 million, okay, 3 million, this is even just the first dose. 3.7 million people who were vaccinated, and only 11 died, which could they associate? First of all, it may be the vaccine. It is not really even yet certain whether it was because of the vaccine itself, but could be because of COVID, because we know there are failure rates. But even with that, you can see that the death rate is very, very high. Now, it is also very important to realize that if we are not going to take the vaccine, we become manufacturers or factories of what we call COVID variant. And this is what we are racing against, because now you have the Beta here in South Africa, you have the Lambda in Peru, you have the Delta, and now they have Delta Plus, which is very, very contagious. Why? as the virus replicates, as the virus actually transfers from one body to the other, they become really more resistant and become even stronger. And so if people are not going to get vaccinated, they get the virus. And when they get the virus, then they can develop into variants, okay? So we have to realize, you see, that also the vaccine does not contain any viral, what we call parts, and it does not cause any COVID, okay? Now, Mrs. White herself had a injection of what we call smallpox virus, vaccine, because she realized, she said, oh, I want to take care of my body, which God gave me. And similar, she said, it is also my responsibility not to transmit the virus to some other persons. So we have a very good example of Mrs. White who accepted this vaccination, okay? Unfortunately, we're running out of time. Okay. And also, later on, you know, what's going to happen is that they're going to have vaccine passports. And this is it. For instance, I'm able to come here to Africa from the Philippines is because I have a yellow fever vaccine card. I had to get vaccinated because if I did not get that vaccination card, then I was not able, they will not allow me to board a plane. So you can see now, this is just one example of what's going to happen. If God has actually impressed on us to be going to be missionaries in other parts of the world, then we really might have to comply because that is what travel is going to do later on, okay? Now, if you want, you have actually all of this, okay, statements about COVID vaccine. How about those who are actually refusing to undergo vaccination? It's very clear, the statement of the General Conference, we are not the conscience of the individual church member and recognize individual choices. The church actually does not mandate, but rather encourages. It is up to the individual to make the right choice. But we need to give them the facts. We need to give them scientific evidence so that they can make the proper choice. But let us not be judgmental for people who refuse, because I know that to some people it is a matter of life and death. They are really convinced that this virus is going to do harm. And let us respect their opinion, okay? Now, for the nay-vaxxers, let us treat them just like what Abraham Lincoln had said, with malice towards none and charity for all. Let us be united. Let us go forward as one, okay? Jesus Christ also says, love one another. Let us respect their viewpoint, because really there are so many people there who have fears that are very real, okay? So let us just present the evidence, and if they still continue with their own ideas, let us continue to love them, okay? Let us not use this as an issue to divide the church, okay? Now, these are some of the online resources coming from the church to tell us, you know, the position of the church and also the vaccine, how it is. So please look at this, take a snapshot, and then look at all of these resources that are available. And once we are going to achieve herd immunity, then our churches can open and we can go back into worshiping together. And I pray that this presentation is going to help all of us to make an intelligent decision, because God has given us a good brain to be able to think wisely. And what is really important is that, is my decision giving glory and honor to God? Is this what God wants me to be? Let us be responsible stewards to the temple, the body which God has given us, and at the same time, be also kind and considerate to others who do not have the same opinion as ours. Thank you so much.
Thank you so much, Dr. Laguno. We are going to have a question and answer session afterwards. We're not going to have it right now because it's going to take a lot of time. But right now, I'm going to ask Brother Wally van Zyl. He had COVID. If he can just share with us his experience in 2 minutes. Thanks, Brother Wally.
Thank you, Connie. If I transgress in the time, please bring me to order. I want to start off by saying that I'm 65. My wife is 63. I do have some comorbidities. I suffer from hypertension, although it's well controlled. Now, we tested positive on the 30th of May. I suspect that I had already started experiencing indications before that, because I could not really do my normal morning walk. I started feeling not too good. So eventually we went for testing, and on the 30th of May, we tested positive. Interestingly enough, on the 31st of May, I received an SMS from the, after we had registered to be inoculated, inviting me to go to the inoculation center the next morning, which obviously we could not do. Now my wife and I, Alice, we have to wait until the 25th of August before we can get inoculated, because of the time period we have to wait after having tested positive. Now, for the first week after testing positive, I felt fine. And I just had a few body aches. I never lost my taste of, my sense of taste or smell. And I thought I was all right. On Monday, the 7th of June, I started having difficulties breathing, short of breath. And my oxygen levels, according to the oximeter, hovered between 75% and 80%. And I went to a hospital, and we were early in the morning. We were there at the emergency area of the hospital. And the doctor admitted me, and I was lying there, and they started doing tests and took chest x-rays. And then I heard him saying, no, this man has COVID pneumonia, we'll have to admit him. But there was no bed for me. And this was now already beginning of June. I waited for 18 hours in emergency for a bed. Now it's worse, I know that. A gentleman that occupied a bed sometime later next to me, he waited for 36 hours in emergency before a bed was clear for him. And one receives these massive doses of medicine, and the cortisone, although I do not suffer from diabetes, I started receiving medication for diabetes because of the cortisone. The cortisone was pushing up my sugar levels. Now, that's one thing. I really do not want diabetes, and I'm trying to avoid all that. So this is one of the things that worried me as I was lying there. And of course, I'm never comfortable lying on my stomach, but that's a proven method of increasing the absorption of oxygen from your lungs. So having to sleep on your stomach with the drips in your arm and all sorts of things, it's not comfortable. Now, the wonderful medical staff in the hospital that I was at, I was in the Florida clinic, they kept on emphasizing that one must adhere to their instructions. The one lady said to me, look, if you adhere to our instructions, if you do it, you won't land up in ICU. A formidable sister from ICU drew blood to measure my the gas levels in the blood. And she was looking at me with a stern eye. She said, can I sit next to you on the bed? I said, sister, by all means. You look tired. She says, I'm so tired. She says, and then she looked at me with a stern eye and said, you must do what I tell you to do, because if you get to my ward, you will do what I tell you. Well, that was enough to scare the daylights out of me. I didn't want to cross swords with that formidable person, wonderful as she is. One morning, the physician walked in, and he said to me, I'm glad to see you. And that shook me. What made him glad to see me? Did he think I was not going to make it through the night? Well, for 2 evenings at least, I did not think I was going to see the light of day. I did not think that I was going to see the light of day, because you hear the people struggling to breathe. It sounds like they have bad whooping cough, people suffering. Sorry, my English deserts me at this moment. But people work 16 hours a day. They are sterling persons. But I said to Pastor Josiane the other day, I prayed such as I had never prayed before. I pleaded with God to keep my wife out of hospital. and to keep me out of ICU. You know, the mental strain is not to be sneezed at. That's also terrible. But you know, I took comfort in knowing that my congregation was praying for me, my family overseas, people in Australia and in the United States. And I firmly believe that the intercessory prayers that was prayed to God on my behalf is the reason why I did not go to ICU. And why, with a struggle for home oxygen, I was discharged on the 12th of June. I've now not had to use oxygen for about 8 days. I still get tired easily. I've not been able to resume my exercise program. And time will tell whether I have long-term health issues, health problems. You know, I praise God for His mercy and for the infinite love that carried me and my wife Alice, through this traumatizing experience. And just as a side note, I mean, I've got a time limit, so I can't tell everything in detail, my whole experience. But just as a side note, the person through whom we became infected, along a chain, two or three other people, he was in hospital, not the same as I was at, but he was also in hospital in the same time as that I was in hospital, 54 years old. He passed away in ICU, but God preserved my life. And I do not want to get COVID and go to hospital again. On the 25th of August, I will go to the nearest vaccination center and see if I can get vaccinated. Because in my instance, the risk of side effects to me is less than getting full-blown COVID again. Dr. Laguna indicated the percentage of people with hypertension in New York who passed away, and that shook me a little bit. And I pointed it out to Alice. I said to her, look at this, because she knows, well, obviously she knows that I've got hypertension. But thank you, Connie. I think, I hope I didn't speak too long.
Thank you very much, Brother Wally. We just wanted someone who had COVID recently to share their experience before we hand over to Dr. Mbenenge. And thank you so much, Brother Wally. We really appreciate you sharing your experience. And I'm sure a lot of people can relate. Dr. Mbenenge, can I hand over to you now? Thank you so much for being willing to teach us more on vaccines.
Hi, Connie. Can you hear me?
Yes, we can hear you and we can see you. Yep.
Thank you. Thank you so much for inviting me. Let me just share my screen.
There we go.
Thank you for the invitation. Greetings to the brethren in the chat, in the Zoom. I'm glad that Dr. Laguna had to start and give a perspective of on the church side in terms of the vaccine, where the church stands. Because I'm going to be focusing more on academic side. It's a serious topic when it comes to the church, even more heavy than on the science side, on the academic side. So one needs to be clear in terms of what I'm portraying today. So basically what I'm going to be providing is the academic side, what literature is saying. I'm not going to be looking in terms of the people's myths. I had a chance to get all the views of people in terms of the vaccine. And it was interesting, all the videos that they sent me, the advice, the comments. But I am here not to answer the question, because I know today the question is the talk says SARS-CoV vaccines, to vaccinate or not to vaccinate. I am not going to answer this question for anyone. I need to be clear on that. I am just going to be bringing the scientific facts as they are. I'm going to try not to hide anything. I'm going to try to be as clear, not academic, too much academic, as much as I can. So forgive me when I use a term that is confusing to people. As Connie has introduced me, my name is Nonhlanhla. I prefer to be called by my name. Benenge is my father's surname, and I'm married to Dr. Moipulai. So I'm one of the lucky women who carries a double parent surname. So I'm Benenge Moipulai. Before I start, I would like to do a disclaimer. I'm coming from an academic side, so one needs to have disclaimers in terms of when presenting information. The information herein is obtained from literature research and is referenced accordingly. The views expressed in this presentation are those not of those of the institutions that I work for, or the organization or committees that I'm affiliated to. I will be presenting in terms of the different vaccines. I do not benefit from any, none financially when I'm coming to this topic. I was just requested to give the academic side of in terms when it comes to SARS-CoV vaccine. I'm glad that Dr. Laguna highlighted that vaccines are basically an additional armament. Okay, I am still going to echo on that. Vaccines are an additional armament. So my talk will be in that line in terms of additional armament. It's trying to explain this additional armament that we are highlighting today. So my talk will try to cover those 8 aspects that I'm just outlining now. The importance of vaccine in terms of vaccine development, what the vaccine were intended to achieve. And then we're going to look in terms of the natural infection immunity versus the vaccine-induced immunity, because then it will help people to have a perspective of what vaccine are trying to achieve. What we're trying to achieve when one uses a vaccine. We're going to look at the different types, as Dr. Laguna had highlighted, that I'm going to kind of zoom in the different types, and I'm going to take time in that arena to try to make sure that people understand the types of vaccine and how it works. So those 3, number 2, 3, and 4, I'm going to take some time and be slow on it so that people get it. The others is just to emphasize on what I have already said, which I'm going to highlight the authorized vaccines currently that have been released as post-marketing that can be being utilized at this stage. I am going to briefly look at research in terms of vaccine efficacy and effectiveness. I'm just going to show data that, just a brief data of what's been out there and what is said in terms of vaccine efficacy and effectiveness. And I would not want to hide anything about the vaccine, and Dr. Laguna did highlight there are challenges, and I'm going to briefly look at those challenges and highlight them, which are already been reported, including the side effects. Yeah, I'm going to be covering the side effects that have been reported in terms of vaccine, and look at the current vaccination status. I just want to time myself so that I do not talk thinking that I've got plenty of time. So apology on that one. As I was preparing and I was trying to read and look at what Sister White talks about in terms of vaccine, and Dr. Laguna had highlighted what the other aspect of it, I didn't find anything except that Sister White did take a smallpox vaccine. There's no evidence in her literature that talks specifically about whether we, as a church, we should vaccinate or not vaccinate. Let me say, as Christians, we should vaccinate or not vaccinate. But I found this quote, which is in one of the books that I have in the house. People can see it. The Medical Ministry is one of the books that are in my shelf. And I found it very relevant to what I'm saying. It says that which relates to prevention of sickness is of a special value, for as an old adage tells us, an ounce of prevention is worth a pound of cure. And I really feel that this is very relevant to what vaccination, the purpose of vaccination. So let me start looking in terms of the importance of vaccine development. Why was it necessary to have vaccines? It's immunogenicity. So it takes us back to history in terms when the times of the pioneers of vaccination is where there was a rampage of smallpox. And what they realized is that the milkmaids, the ladies who were milking the cow, who were exposed to cowpox, didn't get the disease. So these women were milking and they get exposed to the cow's virus, and somehow in their body accepted the virus and built immune response that eventually protected them from this rampaging smallpox at that time. So that's where the element of vaccination is coming from, that if you can stimulate the immune system to know there's a danger, you are able to protect yourself from having a disease. So that's the element of immunogenicity, where we're trying to prevent clinical infection. That means one getting the infection. You are trying to prevent disease coming from the infection, and trying to protect against, because there will be those that are asymptomatic but spreading the infection. And when we can achieve this, we can establish what is called a herd immunity. And you will realize in the news that is talked much about this herd immunity and what does it relate to. Basically, herd immunity is depicted in this picture that I'm showing here. If you've got a population, is the blue, susceptible, it's a susceptible population. That means you have not experienced a particular disease at all. That means you're vulnerable to the pathogen. The disease will spread among the people. So those people will be infected, will have the disease. As long as there is a susceptible population, the disease will, the pathogen will circulate and cause disease. But if you have if you vaccinate and you vaccinate a fewer individuals, okay, and you still have a big pool of susceptible, you will still have the disease circulating, causing disease in the population. But if you increase the vaccine coverage, that means a higher number of people get vaccinated, then the disease stops to spread, because indirectly those who are susceptible becomes fewer, and they become protected by the majority who have already built up immune response against the virus. So the disease dies out from the population, not because of the infection is not there, but because the majority are protected. So they protect the few susceptibles. So it's an indirect protection of those, by whatever reason they cannot get vaccinated. So that's the element, hope it's clear of why we vaccines are there to establish herd immunity. So when we once establish this herd immunity, as I've highlighted, you see a disease dying out. And this is clearly depicted in this picture, okay? This is a polio case scenario. And if you follow in terms of reading about polio, you will know we are almost at the edge of eradication. Eradication, that means we are not seeing the virus circulating at all. So we are at that element. And from a high disease outbreak in the 20th, in the 60s, in the early 19th century, and looking at the introduction of the vaccine, how the disease had died out. And even currently, we only have 2 countries that are still having polio. The rest of the countries or continents, they don't see polio because of vaccination. That's how impactful vaccination can be. And it's the same with measles. Introduction of the vaccine has caused the disease to die off. So that's what we're trying to achieve in terms of vaccination. Okay, I hope that point came out clear. Let's move on now to look in terms of natural infection immunity versus vaccine-induced immunity. Before we get there, let me just try to highlight terminology, because people get lost in terms of terminology. I'll be using the term SARS-CoV-2 in this talk, okay, which means severe acute respiratory syndrome coronavirus 2, okay. And basically SARS-CoV-2 is that novel pathogen that emerged in China from December 2009. And we know, as Dr. Laguno, and I'm sure many of us know by now, that it is a coronavirus because of that crown shape. It depicts when you look in terms of the structure of the virus. Secondly, there's this other term, COVID-19, which stands for coronavirus disease of 2019. There is that loose terminology where people mean to talk about the virus, which is SARS-CoV-2, but they call it COVID-19, okay? These two are not the same. So I'm just highlighting because I will be using the correct terminology, so I don't want to lose people along the way. So when a person says COVID-19 to me, I am looking at this person is talking about the disease that is caused by the virus, okay? So I will not be thinking in my mind, being in the academic setting, that they're talking about the virus. So I will not use them interchangeably. So SARS-CoV-2 is the virus. COVID-19 is the disease that is caused by the virus. Right? I hope the terminology there is clear, because that's the most that's confusing. So the other term that I want to highlight is a vaccine. When I talk about the vaccine, I'm talking about the product, okay, that is used to induce an immune response. Vaccination is the procedure, okay. So those are the terminology that most people we get confused in terms of utilizing when you're talking about vaccines and vaccination, about the disease, SARS-CoV-2 versus the disease, the COVID-19 versus the virus, SARS-CoV-2. Let me go quicker. SARS-CoV-2 infection, if you look at this diagram that I've placed here, this individual gets coronavirus. And if you look at the timeline, you can see from the person, when the person gets the infection, probably they're still okay, but the virus is already replicating in the upper respiratory tract, okay? And by the time they develop now, they start to experience symptoms, what we call mild, moderate symptoms. The virus is already at its peak. It's already multiplied and multiplied. And if you look at its peak, the immune system has not kicked in yet. The immune system, I'm looking at the antibodies, which are depicted by the dotted line. Okay, so my professor is moving away. Yes, these are the antibodies. So if you look at here, this person starts developing the antibodies. Is already over 5 days. The person is already, the virus is already in this, busy replicating in the person. Some people, which is majority of people at this stage, will be able with that point in time to mount antibodies that will be able, even though they are starting to pick up, will be able to curb the infection. Okay. My professor keep on going away. Okay. Will be able to curb this infection. But majority, by the time the antibodies get stronger and stronger, able to neutralize the virus, the person, if you see in the line there, the person is around about here, the person is already in severe disease and is already in the hospital in the severe case side of illness. Okay, and so our bodies are slow in terms of a naive disease. That means a disease that you get for the first time. Our body mounts antibodies over a week of exposure from the virus. So it takes a week, and to some even longer, in terms of mounting these antibodies to be able to neutralize the virus, of which at that time the virus is busy replicating. Its job is to replicate, is to form copies of itself. Okay, so I'll not talk about the clinical element at this stage. I'm going to be focusing strictly, what I'm trying to highlight is going to be related to the vaccine. Here in these pictures, I'm trying to highlight the virus, and I want to highlight the key components that we're going to be carrying forward in our talk. Is this, we're going to talk about an S protein. It's called a spike protein. Okay. This is the basic structure of the virus, the basic virology, which I'm going to try to make it as basic as best as I can. So the virus in that element, the spike protein, the outside protein of the virus, that's what forms the crown, as Dr. Laguno highlighted. They are key component because it's with the research we have realized that these are the portion that helps the immune system to mount. The antibodies are mounted highest against the spike protein. Okay, they can be mounted for the other components of the virus, but the spike protein is the one that causes mounts what we need, the neutralizing antibodies best. Okay, so please carry that name, spike protein or S protein. Okay. For the virus to replicate itself, it needs all the other elements of itself. Okay. Especially the inner portion, the RNA. This is an RNA virus. It's a ribonucleic acid virus. Okay. So it needs this genetic material for it to replicate. So without the genetic material, that RNA, it cannot replicate. I hope it's clear. Okay. Without the RNA, it cannot form copies of itself. So what the virus looks like in sequence when we do in terms of right now, we are sequencing the virus, looking at its whole genome, the whole RNA genome. It looks as this component. Please keep this picture in mind as well. It's formed by, these are gene segments of the virus. I'm not going to go into details of it as well. So it's got components of it. And there is the gene for the spike protein, the S. Okay. Please keep also this picture because we're going to talk a lot about it in the next few slides. So anyway, So when the virus comes, this is our cell on the line there, that's the cell membrane, that line. So for our cells, we've got receptors that are protruding out, like my sister will call them arms. So they come out as arms on the cell surface. So the virus utilizes the spike protein to hold on to these arms, and these arms are called what we call them ACE2 receptors. We've been talking about ACE2. You can hear when people talk about the ACE2 receptors a lot. These are the arms that are protruding from our cells. This is our cells. They have to have these receptors on its surface, and it's not only these receptors. You will hear I'm going to talk about the MHC receptors as well. There are several receptors that are there that are outside our cell. So, but then the virus attaches itself on these ACE receptors, and it gets fused to the cell membrane, and then it's easily absorbed. Once it gets fused to the cell membrane, it can easily be absorbed inside the cell. And once it's inside the cell, then the virus will release its RNA, and it utilizes RNA to make copies of itself, and will make millions and millions of copies in one cell. So what happens there? So we've got 3 levels of protection in our bodies. The outer level, which I'm not going to be discussing now, which your skin forms by your skin, is formed by your the enzyme that your body secretes, like in your saliva, your gastric acid. Those are the first element of trying to protect your body from invaders, any pathogen. The second arm, which is very important, is your innate arm. This is a non-specific immune response that, when a pathogen comes in, tries quickly to remove. So it recognizes, what the immune system does, recognize anything that is not itself. If anything is not itself, it's got a pattern that it looks for and is able to clear. We've got these antigen presenting cells. These are cells that when a pathogen comes in, they grab the pathogen and introduce it to the cells that are important to kill it, which we call them our soldiers. We've got different kinds of soldiers. And in the innate arm, we've got, I usually call them the policing, the community policing forums, or your South African police services. So they go and arrest this and kill this virus. But then, should this not be able to be effective, then they call the big guns. And the big guns are your adaptive immune response. I am not going to go to confuse and go into terms of the details of the whole cascade, but basically in the adaptive, we've got 2 important cells that I want to discuss, is your B cells and your T cells. Your B cells are the ones that are going to produce antibodies, and antibodies will go and bind the antigen or the pathogen and neutralize it, okay? And your T cells are the ones that they activate your B cells, and at the same time are the one that cleans up all the infected cells. If you've got an infected cells, they go and remove it and delete it so that you clear the virus. So at the end of cleanup, you will have what we called memory cells. So your B cell, those that are going to produce your antibodies, and your T cells, that those that are the mopping up cells. So they remain, because they become important, because now they have got a memory. When they attacked the virus, they created a memory. They looked at the pattern and they will have memorized the pattern. That's why they're called memory cells. So those are the key areas that we're going to talk about a lot. So those are the cells that I'm talking about. And just quickly, when you get exposure to a virus, this is a natural infection. When you get exposed and you mount what I've just highlighted, that's called a primary immune response, okay? And you've created these memory cells, such that when you've got a repeat infection, now, since your cells got a memory and they know the pattern, they were able to mount themselves quicker to go and clean up and mop up the infection. So that's the secondary response. That's when you get exposure again and again to a virus, your body is so quick now to act in terms of cleaning up the infection. It no longer takes the week plus to create these antibodies or these T cells to move up. So what's happening here in terms of vaccine? The vaccine are trying to mimic your immune response. So they are mimickers of what happens to your body. So for a natural infection, you have to get infection and then you have to develop the immune response. But with the vaccine, we are introducing the antigen, introducing a portion or a component of the virus so that your body recognizes the pattern. So it's going to follow the same route. It will recognize the pattern. It will stimulate your B cells to produce your antibodies. Your T cells are going to be activated to come and mop up. And then you're going to develop your B memory cells and your T memory cells. So that's basically, in short, what vaccine are trying to do. So that's a simplified version, such that when you get vaccine, which that's the start point here, the vaccine antigen, you're going to mount the primary immune response as you would have with a natural infection. So that should you meet the pathogen now, in real, now you get the infection with the virus, your immune response doesn't say, oh, okay, I've got a fake one, now I've got a real one. No, it recognizes a pattern, a sequence. So it looks at the sequence, that sequence that I was showing about, that pattern of the virus. So it recognizes the pattern, say, oh, I know this one, this pattern, and then it mounts a quick immune response to act. So that's what the whole natural infection versus vaccine induced. It's a mimicry, okay, but mimicking it without having to go through the illnesses that has been highlighted, the whole cascade of being infected. So let me quickly go to the types of the vaccine that we have. Over the time, we have learned the technology is becoming better and better. It's going with the times, you know. We started in the olden days, people, they didn't know the phones. And then the phones were created, then that way there's poles on the streets, phones. And then there were those phones that you have to dial with your arm, you have to use your fingers to dial. And then they created the mobile phone, which were big. And then now we've got smartphones. So technology is improving with time. So is the technology in terms of creating the vaccine. Okay. So this vaccine I'm highlighting here, these are traditional vaccines. These are the old type vaccine. And if you can look, the live attenuated and the killed whole organism of vaccine. These were created 17th and 18th centuries ago. Okay. From the 19th century, we introduced the toxoid, where we were able to utilize a toxin, a poison, and able to neutralize the poison and able to use it as a vaccine. So technology has improved over time. So the current vaccine that we have for SARS-CoV, some of them follow the old traditional ways. Okay. You highlighted in terms of the Sinovac, the CoronaVac vaccine, followed the pattern of a killed vaccine. I'm going to highlight quickly on it. And we've got the other component, the recombinant component as well. I'm going to highlight because we will have vaccines also, not currently at this stage, but they are coming. When Lagun was talking about nanoparticles vaccine that are coming, most of them are recombinant vaccines. So I'm going to be highlighting just what it means of what type of vaccines are those. So, and here we've got the new kids on the block. Okay, and some of us become excited, and I know there are some who are not happy about those. Okay, which is fine. So the new kids on the block is the viral vector vaccine. This viral vector has been the technology has long been there, but has not, at the time, we were still under research. It's only in 2019 when they created the Ebola vaccine that it came out to be utilized, okay? And the new kit now, which making everybody go numb and crazy, is the nucleic acid vaccine, which also had been a technology that's been developed over the time. It's just that now it comes to a play. So these are your RNA, the mRNA vaccine that I'm going to be highlighting. Okay, so let's go to this, how these vaccines work. Okay, inactivated, the traditional one, the old type. Okay, you take a vaccine. This a virus. I'm going to talk about virus at this stage because we are here to talk about SARS-CoV-2. I'm going to make an example with it. SARS-CoV-2, you take the SARS-CoV-2, you grow it into a cell, and as it grows into the cells, you're not utilizing in the lab format, you're not utilizing the human cells, you're utilizing other cells that you want to grow the virus. And you grow it over time, and you keep on doing this over time, and it's about 80 to 100 times you're growing this virus. With time, you keep on, as it grows, you take it out, you regrow it, it becomes weaker and weaker and weaker with time. And eventually, it becomes so weak, it cannot cause disease. It cannot cause any human disease. And then is when it's utilized. Okay. Those are the live vaccines. But the killed one, you take the live vaccine, you put it, you put it in the lab-based format, and you utilize chemicals to kill it. So basically, you're going to go and kill this virus, okay, using chemicals. Could be formaldehyde, whatever that the company will be utilizing in terms of killing that vaccine. But traditionally, they use formaldehyde to kill the vaccine. And then it's purified. After being killed, it's going to be cleaned up. And after being cleaned up, then it's going to be utilized as a vaccine. Recombinant, okay, vaccine. You're taking a portion. Remember when I said remember the sequence that we're utilizing. So you go to the virus, the SARS-CoV sequence, and you go and cut specific gene that you want to utilize. For SARS-CoV, you know that the spike gene is the potent in terms of stimulating your immune system. So you go and clip that S spike protein section of the gene, and then you insert it to another cells, and you can use cells like DNA cells, the yeast, or you can use a plasmid to make sure that to join this piece of the gene to this new DNA. So it's not a human DNA. This is a lab-based methodology where you use a DNA to insert it on a particular DNA after you've rechanged that, because it's a single-stranded, so you need to make it a double-stranded. It's a whole process in terms of the lab, and make it a double-stranded. Then you take that new gene, the gene that you have made, you insert it in the yeast, then you allow it to grow into a cell, in cells. As grow into a cells, because it's got that protein that causes the S protein, S gene. The S gene is to form S protein. So in the cell, it will form the S protein. And from there, then you can take the S protein that is being formed, you purify them and utilize them in terms of vaccine. So you're not using the whole component. Remember, I said the virus to replicate, the virus to form itself, it needs its component, full component. It needs especially the ribonucleic acid. So here you've taken a portion, a gene, and you've set it in another different DNA and insert it in your cell to produce the protein. And then you go and retrieve the protein and purify the protein and use this protein now alone to make the vaccine. I hope it's clear. A viral vector vaccine, it utilizes almost a similar methodology. Is that now the gene, that S gene that you've taken from the sequence of the virus, you are not using a cell, you're using a virus, a live virus, and you insert it on a virus. So, and you utilize a virus that is known. Here, for the sake of this presentation, the SARS-CoV-2, you're utilizing an adenovirus. The J&J vaccines, they're using this methodology. They taken that specific gene, they put it on the adenovirus 26, and it's known not to infect men and not to cause any illness in men. And then they're going to introduce and modify this virus to make sure indeed it doesn't cause any, it is not replicating. So it's a non-replicating virus, and utilize this virus in terms of exposure. So when it enters the cell, because of this specific gene, the virus is going to produce the S proteins. When it produces the S protein, the cell is going to reflect the proteins, okay, to the immune system. I'm producing this protein, and the immune system will recognize this is not self. I don't know this as protein, and it's going to mount an immune response towards the S protein, of which it goes back to what I've been talking about in terms of natural infection. It's going to recognize the pattern of the S protein and mount immune response. And those were the viral vectors. And let me go to the mRNA vaccines, which are the ones that are causing more talk and myths in terms of vaccine. The mRNA, they are not that much different. Let me just start here and say, each and every cell, it's got an mRNA, it's a messenger RNA. Okay, messenger RNA, as the name says, they are message. So they should your body should be short of a specific protein, and it's needed. The messenger RNA is the one that forms the sequence to say, go and make this protein. Okay, so a copy is made from the DNA. It moves out of the cell to the cytoplasm, to the ribosomes. The ribosomes read the sequence. They read the sequence of the protein that is needed, and they produce that specific protein. So this methodology is utilized for vaccine now. So they take it in the lab. They created a messenger RNA that is for the S gene. Okay. That's for the spike protein, for that S, which relates to the spike protein. So this messenger RNA, because it's a messenger RNA, if introduced to your body, it will not enter your cell. Remember, it needs to be picked up by your cell and for it to function. So they put a lipid coating around this messenger RNA so that it's able to attach to your cell, okay, so that when it's introduced to you as a vaccine, the lipid plate, it would attach to your cell and you'll be able to absorb into your cell. It will not go to the nucleus. Our DNA is in the nucleus. So this messenger RNA, it will not go there because it's a messenger RNA. It works in the cytoplasm. It's going to go to your ribosomes. Okay, this is the machine of the cell, and goes to say this machine of the cell, I'm having this message to produce this protein, and your cell will read the sequence and start producing the specific protein that has been given. And now it's been given to produce a spike protein, and it produces the spike protein, of which it will highlight it. Remember, maybe something that I forgot to put it clear. Each and every cell must have an identification. So our immune cells, they go around circulating and they keep on checking each cell. What are you doing? What are you doing? What are you doing? So a cell must produce, utilizing what you call MHC to say, Mina, I'm doing this protein. Okay. So these cells are going to say, I am producing these spike proteins. And your immune cell will say, I don't know this pattern, it's not ours. And then it will recognize the pattern and mount an immune response and formulate your antibodies, activate your T cell to come and mop up and clean up. But in this whole processes, your immune system has been activated to recognize now the pattern, recognize the pattern of the spike protein, where I don't know this pattern. So in these processes, you're building up your memory cells, your B memory for the antibodies and your T memory for your T cells. That is what is happening in terms of vaccine. There is nowhere where it's going to your DNA, it's going to be part of your DNA. There is no way that you're going to be producing live viruses that are going to be, as one of the videos saying, this lady said, you're going to be producing and lots of viruses. No ways, okay? You're producing the proteins. And your immune system is going to recognize this protein as not self and mount an immune response to them. I hope I was clear enough in terms of that. So from here, I'm going to try to go as quickly as possible so that we can allow ourselves time to have a question. Looking at authorized vaccines, SAPRA, this is South African Health Product Regulatory Agency that looks in terms of the products that come into the country. Which vaccines are coming to a country, whether are they have to look in terms of the data, they look in terms of the research, whether are good before they're authorized. So far, we've got authorized the approval for Johnson & Johnson, which is already started being given already for the healthcare workers in phase 1. And we remember AstraZeneca, it came to the country, but eventually we couldn't utilize, it got expired because there was a question in terms of its effectiveness. Okay, but it is approved in terms of being utilized as a vaccine in the country, and data has come up that it is very effective, even effective to the variant, to the SARS-CoV-2 variants. The third one is the Pfizer, which is currently in the phase 2, is utilized for phase 2. And last week, the SAPRA has approved the CoronaVac. Many of us know it as Sinovac, but the name of the vaccine is CoronaVac. The Sinovac is the company that's producing it. Sputnik, this is another vaccine that is there's an application for utilization has gone to SAPRA. If you look in terms of reading the regulation in SAPRA, you'll know that it is they've got the application for it to be utilized, but they're still scrutinizing the data and the evidence for utilizing in our country. So it's not yet authorized in South Africa, but it's authorized in other countries. And Moderna is not approved in our country. But if you look under FDA vaccine, there is an approved vaccine. So I'm not going to highlight these two vaccines because they're not SAPRA approved. So I'm just going to go through quickly to those that are approved in our country. So we've got J&J vaccine, and we know manufactured by Janssen Pharmaceuticals. This is a viral vector. That means it's using the adenovirus to introduce which encodes the spike protein, okay, in terms of the type of vaccine. So we call them viral vectors, okay, but it's an adeno 26 vectored vaccine. It's a one shot and it's recommended for people over the age of 18. So if you're less than 18, it's contraindicated. And if you've got a history of severe allergy, it's contraindicated for use or use with caution. AstraZeneca is follow the same pattern as a J&J. The only difference is that it's 2 shots, which are given 4 to 12 weeks apart. The others, it's more or less the same. And also the manufacturer is different. Pfizer, this is the one, it's an mRNA, is the one that utilizing the messenger RNA to encode the spike protein. It's 2 shots that are given in your arm, and they're 21 days apart. Okay. It's recommended for people over 12 years of age. So anybody who's under 12 is contraindicated. And the last one, the new arrival, your CoronaVac, is an inactivated. This is a killed whole SARS-CoV-2 virus, but is adjuvant based. That means it's given an additional boost to prone your immune system to function. So with an added boost to stimulate your immune system. It's given its 2 shots that are 28 days apart. It's contraindicated to people less than 18 years of age. So if you look in terms of all this vaccine, so there's an element of allergy that it has been highlighted in all of them, okay? Because the components of the vaccine may trigger an allergic response to those people who are literally having a hyperreactive immune system. But it's not a complete contraindication. It's an indication to say if a person who is vaccinated, they must be monitored for an allergic reaction. So let's look at in terms of what we have in terms of the vaccine efficacy, or when you talk about vaccine efficacy, you talk it in terms of before the virus comes in to be given to everybody in the population, it goes to clinical trials. This is the arm that we do not see. It's given to few individuals, introduced firstly for safety in few individuals, and then if it's safe for those individuals and a bigger pool, a pool is given the vaccine that's called phase 2 to see whether it's getting those people are getting immune response. And then if they get immune response, then you increase the number. So you basically start with small group, you increase the big to a larger group to see whether the vaccine is working. Those are phase 1 to phase 3 clinical trials. Should it shows efficacy, that means shows an immunogenicity, able to mount a response, then it goes to a bigger population. Then when it's allowed to be utilized by a bigger population, like at this stage, phase 4, like we're having at this stage. Now we are looking at effectiveness, because now we're getting a bigger pool of people whether the vaccine is working. But the term I usually utilize interchangeably. So what we're looking at in terms of for the SARS-CoV-2, what we have research have shown is that it's able to prevent infection. Once you mount immune response, it will protect individuals from infection. Okay, and many people, they will probably have asymptomatic, if though for some people which they are not prevented from getting infection, they will have asymptomatic infection, okay, but is able to prevent disease. There will be only a few individuals that will have an infection that will cause them disease once they get vaccinated, because it prevents disease, it prevents hospital admission, and it prevents death. That's what, when you look in terms of effectiveness of the vaccine, and our vaccines have shown that. Now it's a busy slide, and I want people to concentrate on the last section here, the column at the end, your vaccine efficacy. If you look in terms of the Pfizer one, and we can see it's about 95%. It's highly effective, okay. It's above 90% effectivity. So these two, Pfizer and Moderna, these are the mRNA vaccine, utilizing that mRNA, okay. So they're very effective. Whereas is the AstraZeneca, which is adenovirus vector-based vaccine, it's at sorry, is at 62%. And I'm not going to go through all of them, but you can literally see that this vaccine, at the beginning, J&J was at 66 in terms of the clinical trial. But as the vaccine was given in terms of now new data is being generated, we are literally seeing that these vaccines, they are, in terms of immunogenicity, it's good. So this is literature. It's something that people can go and read about. WHO, CDC, even our own government has produced a website that does give good information, not myths, good information. And I would definitely ask people to go and research and look at literature. This is a US study. They were looking at effectiveness in terms of the Pfizer. This is a study in England looking in terms of this mRNA, and all of them show that with just one dose of the vaccine, your person is already mounting above 70% or will already mount a good immune response. And if you get a second dose, above 85%. This is a study that was done in Israel. Same pattern is shown. If you can look at this graph, when they introduced the vaccine in terms of phases, in their phase 1, when they introduced the vaccine, phase 2, and the third phase, they have reopened their lockdown regulation, because they can see the disease, the infection getting reduced. This is the study that was showing the CoronaVac, the new arrival, and how it is effective. And if you look at this slide, I forgot to highlight in terms of it's already at 97% effective in terms of seroconversion for your body to mount immune response. Highlight, sorry. Anyway, so in terms of the challenges, which I know many people are interested in these slides, the challenges. What is challenging at this stage is that the virus mutates, which is not a problem. It's for us in the virologist vector. RNA viruses mutate all the time. They lack a reading proof. When it synthesizes itself, it doesn't go back and check itself whether I have done my sequence correctly. So it continues to produce itself. So it makes mistakes along the way all the time. So that's mutation. But it becomes worrisome when the mutation, they change the phenotypic presentation of the virus. So the virus, its character has shifted, is more now transmissible, is more now causing more disease. Those are the concern that when you say the virus is a variant, because now it has changed, its RNA, its behavior has changed. So those are the concern. And if you look at terms of this picture, which you find in our Corona website for DOH, we'll see, if you look in terms of the province, I'm looking at how we were having the beta variant all along, and you can see it was just variant all along. And suddenly, around about May, we had introduction of the Delta variant, of which now has taken over. Now, if you look at the samples that we are testing here, that we also did our own study here at Charlotte Maxeke in the lab, and we're seeing that more than 70% of the samples that we are doing sequencing on them, it's a Delta variant. So we can see now there's a new kid on the block, and that's why it's a variant. Okay. So what challenges is the variants bringing that are worrisome? It's the impact it's going to have in terms of the vaccine. Okay, so I'm looking in this busy slide, I'm looking there, the impact on the vaccine. And for different variant that we're having here. And there was, for Alpha-1, it didn't have a problem. The variant, the vaccine, didn't have, all the vaccine didn't have an issue with the Alpha-1. The certainly, what is coming from studies is that was reduced protection in terms of the other variants. as vaccination continues and more research is done, we can see that even the mounting of the immune response, it is produced. So even though whatever the variant is circulating, right now we're having a Delta predominantly in our province. Even the vaccine current, even J&J, even the Pfizer, is able to produce a good immune response in terms of those variants. So one is still protected. There is evidence of protection even if you utilize those these vaccines. So these are the studies that people are doing in terms of looking at this protection. So there are studies there are continuing studies to look at this, what I'm trying to highlight. And the second concern was a breakthrough infection. That means people get the vaccine, but they have infection. Okay. So that's what we call a breakthrough infection, a vaccine breakthrough. I got the jab, but then suddenly I got exposed to the virus and I found myself having the infection. There are those incidents. There are people who don't mount a good immune response, but a very few. So we are seeing a very few. They are there, and we are seeing even in our setting of this breakthrough infection. But there are very few cases of people not mounting an immune having this breakthrough infection. And the last challenge that I want to highlight in terms of the side effects, when you get the jabs and injection, it is for some people who won't feel the pain. It would probably be like a pinch and they will be fine. For some, it will be pain. The injection site was very sore for at least 2 days. Some will have a red swelling. Those are common side effects. And in less than a week's time, they would have gone away. So there will be those that will have sort of influenza-like symptoms, flu-like symptoms. Okay, so they feel feverish, feel tired, and a headache, or syncope is fainting. I feel like they're fainting, but those are mild and they just go away. What is I need to highlight is we're not going to try to run away from it. There are rare side effects in terms of the vaccine, and they are highlighted, they're not being hidden. So remember that people who are giving the vaccine are medical professionals. If they see these cases, and that's how we knew that there's a new novel virus, because doctors saw a cluster of cases. Even here, when we see an event, it's going to be reported, and it becomes something that needs to be watched on. I've already highlighted in terms of the allergic reaction because to the components of the virus, and it's rare. It's 2 to 5 people per million. That means in a million people who got the vaccine, 2 to 5 people will have a reaction. At this stage, it's over 1 billion people who've got the vaccine. So, and we have not had any severe anaphylactic that has been reported, somebody dying from it at this stage. But it's reported. Okay. The other thing that I need to highlight is the VITT, thrombosis or vaccine-induced thrombotic thrombocytopenia, or the thrombosis with thrombocytopenic syndrome. Okay. We know about this. It was highlighted in the news. Our country had to halt the J&J to look at the scale, what is happening in terms of these side effects. And it's been noted also even now in terms of the mRNA vaccine. And I'm going to comment on it just now. The other side effect that has been noted is the myocarditis, but it's seen in the younger age group. These are people younger than 50. In fact, it's younger than 30 to be specific, to be for the cases of myocarditis. These young ones, they present with myocarditis, but so far it's also a mild reaction in terms of the myocarditis, nothing of a heart attack. It's just an inflammatory response involving the heart. So in going back to the thrombotic thrombocytopenia, the advisory committee looked at these cases, and I remember all of us were discussing these cases at the element. We a few cases that were seen in the US of this presentation, but then it needed to look in terms of data. What does data says? And Dr. Laguna had it highlight. We need to weigh benefits versus risk. Okay, it was a few cases of people that got the vaccine and they have this clotting event that was happening in their bodies. And looking at the data and weighing the risk benefit of people having a good immune response to the J&J, it was allowed to continue to the vaccination, but caution has been put in place in terms of be watchful. And people are vaccinated, and if you go to a vaccine station, they will tell you, if you feel please this way, please go and consult. And affects most those who have also blood disorders as well. To my last slide is looking at the vaccination status. Okay, currently, if you can, and to weigh, looking at what's happening in terms of cases. I'll be looking in terms of death. So the vaccination status, we can see Israel has surpassed at 60%, followed by the US and Europe. And we are down there, we're not doing well down there in terms of vaccination. Okay, this is just to be in a slide just to show precisely the numbers, that Israel is above 65% already having reached that state of people who have already vaccinated in Israel. So when you compare what we're seeing now in terms of now the statistics in terms of death, this is Israel. Look at the number of deaths that they're experiencing. This is, I got the slides on the 6th of July. By 6th of July, in fact, yesterday, this is from the website, the Johns Hopkins website, it was 0 deaths reported already in Israel. And if you look at the UK, look in terms of the numbers do not lie, okay. And the US, even though the case of number of deaths, they had declined, and one will say, but now they're having 714 deaths reported on the 6th of July. It's because if you look at that, they are still below the 60% in terms of protection. And what had happened in the US is that WHO laxed the restriction conditions. People were allowed not to wear masks, they were allowed to have social gatherings, and they forgot that there are a pool of susceptible people that have not vaccinated, and that's what it led. And then what keeps the numbers down because other people are vaccinated. And here we are. And if you look at our curves, I should not say any further than that. So basically, my summary of what I'm just talking about is that the myth that we are producing, if you get a vaccine, you're going to produce lots of viruses, you're going to infect people, it's not true. So far, data of what we have is that vaccines are safe and they are effective. Okay, they've shown immunological response. There's a data that in terms of antibody enhanced and what we call a ADE, antibody dependent enhancement. That means when you get the vaccine, you get exposed to the virus, you're going to have a severe inflammation, severe disease, and you die. So many people are going to die. Look at the numbers. Numbers will not lie at this stage. Okay, so we don't have evidence of that at this stage. Okay, and all of this, it's known and it's being watched. So nothing is going to go in terms of marketing without surveillance. There is surveillance to protect the people. The other thing is I want to highlight, before you send information, please read around it. We are people who are readers. I know Adventists are readers. Can we read? don't send information without checking and verify information before you send it. The other thing that I need to highlight is that the health message that we give as the Adventist, the 8 principles of health still stands. Whether you vaccinate or not vaccinate, it still stands. When you vaccinate, you still need your immune system being boosted. You need to still live a healthy lifestyle. Even if you decide not to vaccinate, it still remains. But at this stage, we have an additional armament to protect ourselves. So let's stick to that. This is my closing remark. If any of us lack wisdom, let us ask of God, who gives to all liberally and without reproach, and it will be given to him. So in these few words, I'll just want to say, the Lord is our keeper. The Lord is your shade at your right hand. The Lord shall preserve you from all evil. He shall preserve your soul. The Lord shall preserve your going out and your coming in from this time forth and even forevermore. Thank you.